Means I had a hunger. That was the attention and the focus, still not completed. And to become any dream, you should always have perfect skill acquisition. All of you want to be CEO after your bachelor degree. No way. You have to acquire such a skill that people should come and give you the job rather than you going and asking for the job. So to achieve the skill acquisition, you have to struggle more. So I studied up to the age of 42. So what the age? 42. Next. So I took USMLE at the age of 37. Seeing that I had to go to the US, I had to learn something more and come back. And luckily I passed. It is everything was my own hard-earned money. Whatever the little bit I was getting, not like your parents, we were all not, many of the parents here have come from a different background. And our era, it was a different era. Next. So excuse me for this. And what I had to do is, as a neurosurgeon is, we had to spend innumerable hours in the cadaver lab to see every nerve, every part of the tissue. I have to see three-dimensional picture because each neurosurgery, we do it in a different position. I had to have visual memory before I touch the patient that which part of the brain I'm going to touch. Because we have to touch in 1 millimeter distance only. So to do that, I have to do this. And everybody in the funeral home used to call me which head I will get next day because it has to be fresh head to operate to get the mimicness of the surgery. Next. So I spent hours together, day and night. You can ask my wife. I used to always spend in the lab touching every part of this brain, exactly mimicking the surgery, what I will do in the operation theater. So my lab had every microscope, every ultrasound, what is required so that I can learn each and everything. So next. So I got my fellowship, both in skull-based surgery and the spine. Next. And I couldn't stay in US. I had a job of $500,000. My boss wouldn't allow me. Suddenly one day I decided, neither my body looks like an American, nor my thought looks like an American. And my way of being a doctor is to touch the patient, to hug the patient, to tap the patient, and to talk to them in their local language. Then I thought, this is not the way I want to be. Then one day I told my wife, I'm leaving. We went with the thinking that we may not come back. I said within 3 years, I said, no, I'm going back. And then at the same time, go back. So so still I'm in the attention and self-control. I have not moved from that barrier. So at that time, I came to this beautiful palace. How many of you have seen this? This is not a palace which you people danced, This is the palace, it's the Satish Rudrappa Hospital. It is a charity hospital in the Whitefield where we do the free surgeries. And I worked as a first neurosurgeon for 5 years continuously. And we have done a wonderful work and purely for the experience and the self-control I had. The people who didn't have the vision, we gave the vision. People who couldn't walk, we made them walk. And whatever my friends said vanished from by the time I came back because I could do the surgery in one day, send the patient on the next day. Next. And then I started thinking about being the teacher. I started teaching whatever I knew, bit by bit, to teach everywhere in the world, in the lab, to the doing operative surgery, every part of the world. I go now and do live surgery. Next. So I conduct many courses around the world and I keep doing because it is a social awareness I am doing. What is I acquired the knowledge, I had to put it in the social relevance. And I start teaching everywhere and I have students from Indonesia to Hong Kong, to Canada, to Australia. Wherever I go, I have completed full continents. So that is the worthiness of this India gave me, and I understood that I am worth, I can spread the knowledge to this India to anywhere in the world. Next. So after this, when I came, the Toyota first started its first hospital in the world. And most Japanese came to me when I was operating in one of the hospitals. He said, you ask me whatever you want, we will get you. And today I'm in this hospital. It has the equipment of the highest order. What is there not in, what is not in US? Many of my friends who are in US neurosurgeons, even the, Caucasians, they come and tell me, man, how can you get all the things which I am not having? So when I operate, I will have the technology, what is there around the world, the latest technology to make every patient better. Next. So after that, once I achieved my goal, then I thought, what else I can contribute back to the society? Then I started a NGO called as Sukriya. Sukriya. means do a good deed. So I call this as IRS. There is a CSR program, you must have heard, corporate social responsibility. This is individual social responsibility. This is my responsibility for having studied in this place. My teachers have given everything to me. Then I thought I should do something and I should never refuse any patient irrespective of what they are, irrespective of their economic standards. I treat every patient, whoever it is, and I made my team also run in the same way. So all these patients you are seeing are the patients who underwent a free surgeries in my hand. And innumerable patients, crores of rupees we are doing. Still, I've earned enough what I want. I can take care of my son and 2 children beautifully by giving everything. That means by giving to the society, you will take more, you will never lose anything. Next. So in addition, after that, I started getting the recognition from around the world. I got the FRCS recent 2 years ago, I did not take any exam. Purely because of the activities which I am doing around the world, I got the recognition. The Japan people gave me visiting professorship. So once you concentrate and once you are socially responsible, success will come to you. You don't have to chase it. Next. So I started teaching around the world. This is yet another one. Once again, is the social responsibility. Next. So we started publishing the book around the world, which goes around and I write everything what I know and publish these books. Next. I thought that I'm happy. I was sitting in the Haneda airport in Japan and suddenly thought, what else I can do? I'm still young, like you people. What else I can do? That was a soul search which is happening to me. Then world came as happiness. I was thinking about which is the country which has the happiness index. Then came Bhutan into my picture. When I Googled, I found that Bhutan has no neurosurgeon, no spine surgeon. Then immediately from the airport, I wrote a mail to one of the Rotarians there. I didn't know anybody. Then immediately they said, I started thinking about Indo-Bhutan program. The health minister called me. They accepted me within 1 day saying that we need you. This just happened 2 weeks ago. So that is how, when you do the good deed, it just, goes on. You don't have to get anybody's help. The divine power helps you, your teacher's blessing helps you, your parents' blessing helps you, you pass in a greater way. Next. So, in addition, I'm doing another program for the society now. I'm coming out with the app called as Epilepsy Prevention and Integrated Program because epilepsy is a big disease and we are going to do it within next 3 months to launch in every school in the state. Free of cost, every teacher will identify epileptic patient. We will be treating free of cost in my hospital under my guidance. Next. So, I also do leadership program for the young people because I have innumerable students and all of you can be future leaders of the world. And how I imbibed all the things, I give it back by doing the leadership program. I'm sure many of you will be leaders in the future, like your chief guest who has come as a student here talking. Tomorrow you might be talking of NPS University. That's what, and university will have from robotics to everything. So, culminate in such a way that think beautifully, work for the society. Next. This is what I've built the team. Each one of them, I can vouch and tell you, they're the wonderful surgeons today and the great contributors to society. This is my team. So, I'm passing the baton now and moving on to the next episode. Next. And recently, in Canada, they did an interview for me. I thought what I should talk about is lifelong learning. Learning never ends. Learning never ends. And as long as you're learning, you contribute more to the society. Next. So what I'm bothered here is in my era, it was just between the two humans. There was just a discrimination, people used to do that. If I make that discrimination to go narrow, I would have succeeded. In your era, there is no differentiation between the two humans. There will be between the human and humanoid, there is a robot. So humans are becoming irrelevant. Think differently. Do differently. Because most of the jobs are going nowadays, even in the hospital, we are looking at how to replace the nurse with a robot. So unless you are very good and very wisdom you get and socially relevant, you might miss the chance. Next. This is a beautiful quote from, go back, yeah. Charles Darwin. It is not the strongest of the species that survive, nor the most intelligent, but the one most responsive to change is the successful man. So in that way, I will conclude. Next. So in conclusion, develop happiness, with education, empathy, compassion and gratitude, contribute more to the society Make sure your parents are happy, your teachers are happy, and the nation is happy. You will get whatever you want. Thank you very much. Next. Thank you.
Thank you, Dr. Rudrappa, for sharing with us your interesting thoughts which would have inspired our students.